not very heavily populated yet, which is a real pity because everybody's going to miss out on what's going to be the most interesting session of Davos this year. That's a real pity. Anyway, for those of you that are here, a true warm welcome on behalf of me and the other partners in the Program for Health System Sustainability and Resilience. I'm very glad to have you here. Just before we start, one message. We are going to record this session and it is going to be shared on YouTube. So unfortunately, no chat in the house rules. However, I still am asking you all to be as open and as sharp as possible because we have a mission together and that mission is improving the sustainability and resilience of healthcare systems. Now, before I start with my very honorable speaker for the Fire Chat, Professor José Emmanuel Barroso, just a few opening remarks from my side. Where are we in healthcare at the moment? Was COVID-19 a singular crisis and are we all done and ready for the future once we've overcome COVID-19, or has COVID-19 just been a sign of the time which is showing that healthcare is actually in distress? I think, and we in PHSSR think, that it's the second one. Healthcare is under immense stress. We had COVID-19, but if we look at the future, if we look at climate change, the war in Ukraine, streams of refugees, aging population, multimorbidity, shortage of workforce, we think that healthcare will be under much more stress in the future. And now the time has come to learn lessons from the crisis. So I always say COVID-19 was a very dark cloud, but it had a silver lining because it had taught us some things that we need to address in order to get ready for the future. Healthcare systems need to become much more resilient, much more sustainable. That's why a number of partners started the initiative to start the Partnership Program for Healthcare System Sustainability and Resilience. It's a collection of academia, non-governmental organizations, business organizations, scientists, technology, and we are all coming together to do research. We've been active for 2 years now, have been active in 30 countries to do research in how sustainable and how resilient healthcare systems are. But more than that, to start making recommendations and to start to take care that we can start to act and accelerate on the insights that we have. Before I say more, I think it's very good to give the word to Professor Barroso. Professor Barroso, it's great to have you here. You have such a great track record of being, of course, the chair of the president of the European Parliament, being the chair, commission, of course. We'll delete that one from YouTube.
No, I have nothing against Parliament.
You're the chair of Gavi, you're a visiting professor at a number of universities. So let me start with you about the mindset that we need in order to treat healthcare as a strategic asset. And let's get back to the COVID-19 crisis and how that has exposed the weaknesses in the system and the inequalities across the systems. What, in your view, when you look at how we handled the crisis and what we're doing now, are we on the right track or are we still facing significant gaps?
First of all, thank you very much for inviting me. It's a pleasure to be here with this platform for health system and sustainability and resilience. And I really want to congratulate the sponsors from Philips to KPMG to AstraZeneca, London School of Economics. I really am a believer in the cooperation between the public and the private sector, and I think the input of the private sector to this public health domain is critical for its success, and I will hopefully will have the opportunity to explain why I think that is the case. Now, answering directly your question, I think this crisis was a wake-up call, but to be very honest with you, I'm not yet sure that all the lessons were learned. As you mentioned, I have a very long political experience. The advantage I have now is that I'm no longer in politics, so my level of sincerity is increasing day by day. So I'm speaking to you completely free, intellectually independent, representing no one. So maybe what I'm going to say it's wrong, but that's my opinion based on the experience. And also someone who came recently to this field of public health. I was asked to join as chairman of the board, Gavi, beginning of 2021. And so what I think is that politics has failed completely. That's the reality. Even the most powerful countries in the world, the richest countries in the world, were not ready for this pandemic. The United States, a country that I very much respect and love, I spent there part of my life, more than 1 million casualties. The reality is that in Europe, where I come from, we had no ventilators. We had no basic instruments to respond to the COVID-19. So politics failed. Science basically was a success. The speed at which, for instance, development of vaccines was possible was great and much better than before. Afterwards, to be honest, there were asymmetric responses because there was good behavior and bad behavior. For instance, some governments put export restrictions, excessive stockpiling of vaccines. But to be honest, some of them were also extremely generous in donations and also sharing afterwards the excess vaccines. So my analysis, it's a mixed picture. And also from the private sector, by the way, because there were also problems of supply and ramp up of production. So there were, let's say, it's uneven. But now the question is what to do next. And just now I was in a breakfast of Gavi with the private sector, and we welcome, for instance, the Minister of Indonesia. Indonesia is now the chair of G20. And they are working hard, and I believe with very good common sense, to continue the good work of Italy. My good friend Mario Draghi, that I visited some weeks ago, when they were leading the G20, in fact, they put down some good basis to improve, let's say, the global response to pandemics and the global response to the issue of public health. So let's see. But I'm concerned because today, the level of cooperation in the international world, it's much lower than before. Also because of this tragedy that you are seeing now in Ukraine. So the geopolitical friction is increasing. So I remember this just because what I can share with you probably most interesting is my experience on other matters. We have here better experts than me. But for instance, when we had the financial crisis, in fact, it was ourselves, the European Union, that asked the United States to organize the first G20 at heads of state and heads of government level. I went to see George W. Bush at Camp David, together with my colleague from France, Nicolas Sarkozy, and we organized the first G20. We said the G8 is not sufficient. We need China, we need India, we need Brazil, we need Korea, and basically there was a cooperation between us, the Europeans, the Americans, the Chinese, Russia, not so. I mean, already at that time, Mr. Putin was not so cooperative as he should be, but nevertheless, at least he was not a disruptor. Now, the level of confidence between the major powers is, I would not say zero, it's below zero. So will we be able to keep a commitment for the global public goods, like fight climate change or for public health? Are we going to be able to do it? Question mark. I think we should, but you asked me for an honest answer, and voila, that's my honest answer.
So that's a very strong appeal for collaboration, for leaders to stand up, for leaders to take responsibility to build their healthcare system. If we go to a healthcare system, and it's good that you shared experiences from your, what you have in Europe, your experiences in the US, Indonesia, what does healthcare need to do in the future to remain sustainable? And I think resilience is one thing, but the sustainability, are we still having equity, access? What does the sector need to do?
First of all, I think we need more investment. There has been chronically underinvestment of health in the poor or developing countries. That's the first point. And if not now, when? I think now people understand how important it is. So more investment. Secondly, more transparency. The reality is that there is a lack of transparency in the health system that I was not aware before joining Gavi and understanding what's going on. It's amazing, because a lot of money is spent and we don't see exactly the results. And we have to have metrics, for instance, linking our inputs, namely in terms of investment, to the results in terms of child mortality, life expectancy. There are good indicators of that. But in fact, when it comes to investment in health, I don't see all the time these metrics implemented. Just speaking with some friends from the Asia-Pacific region, some of the poorest countries there, they don't have even statistics about what is the cause of death. What is the cause of death? So if you don't know why people are dying, what exactly was, I mean, how can you change it? So I would say this is the point. And the health resilience is to invest in all aspects of it, namely the public health aspect. That has been also, as someone said, a Minister of Health said, I don't feel as Minister of Health, I feel Minister of Diseases. Because most of my budget, that's the case I just heard, 95% of my budget is for treatments and not for prevention, which is, of course, a mistake. So these, I would say, are the basic points. And as you've mentioned in your introductory remarks, we need to link the economy and the health with the other problems that we have today, from climate change to the refugee crisis, to the energy crisis, to the food security issue. It's an issue of human security. And so the governments have to give this the level of priority it deserves, and that until now, frankly, it was not receiving. So that's why we need to invest in public health and private health care, by the way, as it's one of the Sustainable Development Goals. And I think today there is more awareness to do it. And I believe it's the right time to invest in these instruments so that we can build that resilience and the broader concept of resilience, including, by the way, geopolitical resilience. Because can you imagine, now I don't want to be very gloomy, but can you imagine if we have the weaponization of infectious diseases? Because it can happen, bio wars. So, I mean, it can happen, as we see. So that's why I don't understand why governments today, they don't put this at the highest level of the risks they are facing. Usually, in all governments of the world, there is a list of the risks starting from a nuclear conflict to terrorism to other risks, including climate change. But pandemic risk, in fact, was not receiving the importance it should have received.
And one question to you, one last question to you in that respect, because I hear you saying transparency, collaboration, put it high on the agenda of the leaders. I always use the phrase health is wealth. I mean, just imagine what it means for productivity, people not leaving out. One of the key problems of healthcare, of course, is the incredible fragmentation of the sector. And that's, every country is inventing its own health system. And then within countries, is it private, is it public, providers, doctors, what are the roles? Are you saying here two things, two questions from my side. First of all, are you saying health and healthcare should be much higher on the agenda of national leaders? And what would your main messages be to leaders within the healthcare system?
So both national and international cooperation. From that point of view, let me once again give you an example. The European Union that I was leading the Commission for 10 years. At that time, when the Commission tried to do something in the field of health, there was a pushback from the governments. Because they were saying, and by the way, it was right, that is a national system, national health systems. In Europe, we have national health systems. We were not trying to replace the national health systems, of course not. But for instance, I launched an initiative, it was a network of good practices in mental health. Because I think it's important to know for experts in each country what is happening in the other countries. There was one country, one of the most important countries in the European Union, say, no, they asked my cabinet, what is President Barroso doing? This is not the Commission business, this is your national business. But now it changed with the pandemic. By the way, in Europe, in fact, I'm no longer in the European Union, I'm not here now to represent the European Union, but I think if the Commission basically was doing a good thing, for instance, buying vaccines on behalf of all the 27 countries. If not, some of the countries will have much bigger problems. So I think the regional dimension is very important. For instance, in ASEAN, they're trying to do something. Now, the African Union, they are also making some progress. Because frankly, we need for those, I mentioned the G20, to the global community, we need this more cooperative approach. But in practical terms, I think the regional dimension is more effective. So, and because virus does not stop at the border, like climate change does not stop at the border. So it's obvious that we need transnational cooperation. Now, that does not mean we are going to replace the national health system, because this is the first priority, of course, the national health systems. And we have seen now also during the pandemic that the countries were better, responding better, were those who have already some national capabilities and a national health system to reach the most difficult areas. Finally, a point I'd like to make, because it was, I think, also implicit in your question or comment, we need to make the economic case for health. That's why I said the private sector is so important. Because, frankly, when it comes to the global health, we count on the solidarity of the richest countries. But solidarity, and I mean, because of ethics, is not enough. That's my experience. Of course, that is important to mobilize people, people that are feeling the injustice, inequity in the world, but we need to make the case from an economic point of view. So, if you, as you said, health is wealth, I mean, yes, because the more we invest in health, the increase in productivity, I mean, in life expectancy, but also in productivity, in economic development, economic growth. So it's in fact from an economic point of view, and now the IMF, they published some figures about the costs of this pandemic, for instance. In pure economic terms, it was a disaster. It was a disaster, and still we are feeling it in many parts of the world. So it makes sense to invest a dollar well spent, a dollar or euro, whatever, a dollar well spent in health makes a difference for economic performance, and this is important to have also the governments coming in and be more generous, or to be at least more intelligent about the way they make their investment.
Thank you very much, Professor Barroso. Very good insights, collaboration, cross-border, health is wealth, transparency, very good points from your side. We will now go more in-depth. I thank you very much. I will ask you back on stage for 1 more minute at the end of the session. For now, thank you. And can I please ask on stage? Yeah, that's very well deserved. Thank you. Can I now please ask on stage Leif Johansson, Frans van Houten, Shirley Lin, and Emmanuel Capabianco. Oh, thank you very much. Yes. Okay, we have a panel of 4 very notorious people, and now my main challenge is to get all your names and your roles right, which is not my real forte always, but let's have a try at it. Here, just right of me, is Leif Johansson, who is the non-executive chair of the board of AstraZeneca, AstraZeneca being one of the partners in the Health System Sustainability and Resilience Program. Welcome here. Next to him, we have Frans van Houten, the CEO of Philips, and also one of the partners in our PHSSR program, and of course, having a lot of roles in the World Economic Forum as well. There we have Shirley Lin. Shirley Lin is a visiting professor of world politics at the University of Virginia and a professor at the Chinese University of Hong Kong. And Shirley is very proudly, yesterday, she just launched CAPRI, which is the Center for Asia-Pacific Resilience and Innovation. Congratulations on that, Shirley, and we'll hear more from you on that region. And of course, very welcome Emmanuel Capabianco, who is the Chief Strategy and Impact Officer at the WHO, and who is, of course, also a member of our steering committee of the program. Very welcome and very honored to have you here. And building on the comments from Professor Barroso, let me start by asking a question about how we can strengthen our healthcare system so that we can be much more resilient to the stress that we are expecting to come on in the coming years. And I want to start with the lessons that we learned from the COVID-19 crisis. Now, surely you're based in the ASPEC region, and that's a very diverse region with developing countries, economic possibilities, huge differences in maturity of health systems. Can you, and it sounds a little bit, it sounds a little bit opportunistic, but given the fact that it was so differentiated, can you give us from that region some of the major lessons learned from COVID-19 that we can use to increase that resilience?
Thank you. It's an honor to be here and for our think tank, Capri, to be launched in Charlottesville, Virginia, where I'm based, and in Taipei. And I think it's been wonderful to work with Professor Barroso in the last 2 years in starting to think about how to create initiatives to fill in the gap where the government and civil society and the private sector need to work together but are not. And of course, as Professor Barroso says, governments have failed us in many ways, but we also have failed to make a difference. And so Asia Pacific is one of those regions that is the least organized as a group, as a bloc. In fact, it's an imaginary region. It doesn't even exist. Asia Pacific is so large, oftentimes it includes Chile. You probably don't know that unless you know about APEC. And of course, Biden has told us that Asia Pacific, of course, includes the United States. So to include all of that is understandable. But we spent about 2 years trying to decide where do we find the way to take the lessons from Asia Pacific to contribute to the world and to bring the world also to Asia Pacific. So we chose to actually start this both in Virginia, as I said, and in Taiwan. And the reason is what Professor Barroso just said, which is you cannot disengage health from economic growth. If you don't have one, you don't have the other. We need to empower people with resources to fight the pandemic. So Taiwan was an interesting situation because it is done so fabulously economically because of health. It's not the reverse. Because COVID was so contained, mortality rate there was so low that it achieved, of course, a positive growth rate in 2020 and 6.3% growth in 2021 with record-breaking technology export. So what the lesson tells you is part of APEC. There's 2 lessons from APEC. Number 1 is the trust in government. Trust, we talked about last night with many of the SteerCo members, is not something you can do overnight. Resilience takes time, culture, the environment, that is what resilience is about. And all of the efforts need to be bottom up to create the context for healthcare to be resilient. And we believe very strongly at Capri that we need to look at policy to balance public health, economic recovery, and environmental sustainability at the same time, not as trade-off, and to engage innovation. And that's why our name. And the second thing about Asia Pacific that's very special is innovation. In the first phase, of course, before there were the vaccines and before Gavi could give us any, basically, there was no other way to actually prevent death. But Asia today has 1/8 of the death mortality rate of the Western countries. It's really amazing. And the first phase basically was through non-pharmaceutical intervention, which means basically using technology, contact tracing, and trying to understand what people are doing in quarantine. And all of these things make Asia very special to contribute to the world, but most importantly, with over half of the population in the world and the highest growing region, it is going to be an important part of fighting the pandemic because we are not alone. Now, I want to say one other thing that's very important. Today, Asia Pacific, however successful it was in the first stage, is in crisis because of inflation, Ukrainian conflict, and most importantly, the lockdown in China has disrupted the supply chain. One of our board members is a leading Chinese economist. She's Spanish, and she just came out with a projection that the 5.5% growth in China may be 4.2. That will hurt so many countries in Asia Pacific and not have resources to fight the healthcare crisis we are in. And I think that's what we're focused on, creating long-term resilience. Thank you.
Thank you very much. Key messages on trust and innovation. Well, you mentioned the subject of supply chain. And Frans, you were, of course, in the middle of the supply chain issues during the COVID-19 crisis. And what we saw is that it was a key matter, and we saw behavior like protectionist behavior. We saw unfair allocations. And what we start seeing, maybe on the back of the COVID-19 crisis, is countries wanting to become much more self-sustaining. What does this crisis mean in terms of global supply chains? Will there still be global supply chains? Will we move towards regional or maybe even national supply chain? What's your take on that?
Well,
Can you take? Yeah.
if you look back, the world healthcare systems were utterly unprepared for the COVID crisis. And despite having discussed pandemic preparedness for years here at the World Economic Forum, the lessons learned from SARS, etc., were not really taken into account. Stockpile programs in several countries were not managed well, were expired, right? So they were all useless. And when hospitals had to cope with the influx of patients, there were not protective equipment, there were no ventilators, not enough ICU beds, but there was also no coordination and no orchestration. You mentioned yourself how fragmented this world is. And of course, we as a company, Philips, provides acute care equipment like monitors, ventilators, and other medical equipment that is highly needed in such a pandemic. We find ourselves in the middle of it. The United States issued the Defense Production Act. Everybody was closing their borders. We took the courageous decision in early March 2020 to invest 100 million to do an 8-fold increase in production while everybody was in lockdown, which is a miracle because normally in healthcare nothing goes fast, but we were able to actually ramp up, which I think was great, only to find out that then all governments start fighting to put their hands on the scarce supplies that you can make. So I think what the lessons that we need to learn from this is that pandemic preparedness and resilience is a ongoing obligation, right? That requires a plan that needs to be kept up to date. It requires public-private partnership where companies play their role, but governments also will have to allocate some resources to it. We need to have some game rules like keep supply chains open, keep borders open, keep shipping lanes open, because for healthcare equipment, we actually had to charter planes, right? And all of that was very, very difficult. I think it can be done, but I worry that the moment now that COVID is a little bit less, let's say, on the priority list, we already see governments relax and not follow through. That would be a grave mistake because it is absolutely certain that this will happen again. So I think we could draw up a set of game rules, which we are doing as part of the Partnership for Health Systems Sustainability and Resilience, a set of game rules to say, here is how we shall collaborate. I see some early signs of success. For example, the European Commission, together with the member states, have created preparedness plans, including stockpile programs, that are managed as a service. So rather than putting stuff in a warehouse and then forget about it, private companies are asked to take responsibility to keep that up to date and fresh, so that at any time you can call upon it. And interestingly, already twice in the last year, these stockpiles were being used. For example, to sustain healthcare in the Ukraine. And we were able to react together very quickly. So I think, tough lessons. On the other hand, some optimism that it is possible. I worry a bit that, like the Asian preparedness on SARS, etc., that over time it will be forgotten again. And what really pains me is if you realize that in healthcare globally, there's hundreds of millions of people putting their hearts and minds to work for a better world, how disorganized healthcare actually is. Right? So I'd also love to hear from WHO on how we can strengthen some form of governance around health that is inspiring and not bureaucratic, so that we can see, we all come together to tackle the needs of a resilient healthcare system.
Yeah, going back into that global cooperation that we need to a certain level. I'm just going to switch subjects a little bit. One of the lessons live from the COVID-19 crisis was that social determinants of health are so over-important to determine outcomes. And actually what we saw worldwide is that, and I call it the triple billion of COVID-19, the groups that couldn't go in lockdown because they had jobs outside of their houses, the groups that were in cramped housing with multi-generations, the groups that had a bad health situation pre-COVID, and these groups, we thought everywhere in the world, these groups were hit triple as hard. Number of cases, number of mortalities. So that's, hopefully that brings public health back on the agenda. Now, based on that, and I'm leading you a little bit in the way of the answer, but I would like to have your reflections. Are we investing in the right things of healthcare? What's your analysis on that, and where should we be investing?
Well, I think it's easy to say that we are lacking investments in the preventive and predictive areas, and we are overspending perhaps on the cure side. And the numbers Professor Barroso was saying, and I liked this comment about not being a health minister but being a disease minister. That's actually true in most countries. The OECD numbers say that we spend 3% on preventive and predictive care, and then we spend 97% trying to cure an already established illness. That is clearly wrong. And you can debate a little on how we could move from the 97% to the 3%. I would suggest that it should be 20-80 or even 40-60. And then that does not mean actually that the main requirement is to spend more, but it's to spend differently. And I think one of the lessons, and let me say I have that almost on my own skin after having participated in this campaign for vaccines. We made 3 billion doses. We delivered in 183 countries with a good cooperation with Gavi. But that really taught me that there's a very fragmented world out there. It looks very different if you go even to individual European countries and you say, how do we actually deliver good vaccine? How do we deliver good, in this case, preventive healthcare then? Or if you go to Africa or if you go to Asia. This is why I'm so interested in trying to establish what we are doing at PHSSR, which is to get an international framework, something that individual countries can measure themselves against and help with researchers from that to be able to say, we are doing this and this and this against that international framework. We score like this and we can compare ourselves with that international framework, and we can actually get a constructive feedback from the researchers who make that comparison. That will over time give us the opportunity to find best practice and try to rule that out over time. So I think that's really an interesting setup with PHSSR where we can truly deliver. Otherwise, I would say there are many things that we are not doing that we could be doing very well. One is preventive screening, and for example, lung cancer is one of those diseases. Can be cured if it's found at early stages. Will cost society a lot of money if it goes through a long-term case of very serious illness. So anything that we can do in terms of screening, finding population, etc. There's lots of interesting science, genetics, immune systems, cell therapies that we can use to be able to find groups of populations demographically and try to treat them in a group-wise or even over time personalized medicine. And finally, let me say, I think the use of artificial intelligence and digital. Very good example is that a lung cancer that we spoke about before, you can actually now use artificial intelligence off of simple low-cost X-rays that is being done for different reasons. And you can use artificial intelligence and digital to sort out which might be lung cancer and which might not be. That's an information that normal healthcare system can actually not distinguish from. AI can, but it doesn't require a lot of very expensive interaction before we do that. We can just use the same data, but we can use AI to sort out. That whole digital opportunity is very, very much underspent, underutilized, underinvested, and we can do wonderful things at very low cost. So there's a real leverage in there also. So those three, I think, fragmented, try to find a framework, feed that back to individual countries like we are doing at PHSSR, look at what we can do in terms of investments and screening early on to predict disease and there help save the cost in the 97%, and then also use digital much, much more than what we are doing now.
So digitally clever, a learning world, and not spending more, but spending differently too. Emmanuel, I go back to you, and we have already addressed quite a lot that divide, or maybe not a divide, between healthcare, whether it's a global or a national mission. And I mean, we all know that healthcare is quite often very high on national political agendas. I mean, the NHS is the holy grail in the UK. What's your view on that divide, or maybe the collaboration in the national versus the global mission? What is healthcare in essence?
Absolutely. Thank you, Anna, for the invitation. Let me just to go back to the 97.3% point. Antique Chinese doctors were paid when their patients were healthy. They would not be paid when their patients would get sick. That's a shift that we are promoting. We should be promoting well-being, disease prevention, and not focusing on curative so much. And I think that's the shift that we need to have globally. And when it comes to pandemics, this is absolutely critical. And I think we have a moral obligation. There is also an economic imperative around that. If you look at the cost in terms of human lives, 50 million people that died because of COVID. You look at the 130 million people brought below the poverty line because of COVID. You look at the 14 trillion economic losses. The argument to invest in prevention is critical. And it goes back to the political point that President Barroso mentioned. The governments need to take responsibility. If it was a failure, as you mentioned, President Barroso, it's a political level decision and a new governance that needs to be put in place to avoid the reoccurrence of the panic and neglect that we have seen after SARS, after H5N1, H1N1, and Ebola. And so the World Health Organization, as we speak, in member states in Geneva, are discussing right now a white paper about a new governance, a new architecture for epidemic preparedness and resilience. And I think it's a unique opportunity to really make a major shift. And that includes intervention at three levels. One is governance, one is the system delivery, and the third one is the financing. Three areas that have been touched already by colleagues here. And on the governance side, I think the recognition is that we need a stronger multilateral systems and stronger commitment that is linked to stronger accountability. A pandemic treaty is a difficult journey, but will hopefully bring that coherence, that inclusiveness, and that equity that we have lacked during this pandemic. A revision of the international health regulation will hopefully avoid us to witness the discrimination against South Africa that happened after they declared the Omicron variant, helping the entire world, but being punished because of that. The creation of a Global Health Council may really lift to the level of the presidents the issue of global health protection. And that's the governance. Many of us are very much into the service delivery piece, and there is a lot of work to be done. The health workforce, strengthening that health workforce at the regional level, at the country level, pre-positioning of supplies, having them ready and not expired for the next pandemic, building a surveillance system that is as close as the local level as possible, but is also global, so that as soon as you have a case of monkeypox, you can have an alert that goes around the world and allow us now to track better and better where we are. So that is another big element. And the third element is the financing. the world was unprepared to deal with this pandemic. There was a pandemic facility at the World Bank that was activated for Ebola in DRC, that was activated for COVID. Too little, too late. And I think now is an opportunity to create a facility that can really mobilize resources, first to invest in preparedness, but then to be activated in case of epidemics that have a potential global dimension, so that we are able to close down very quickly. I am very interested to see what's happening, what will be happening in the next few weeks on monkeypox. It's not as lethal, it's not, but it is something that is moving very fast. 3 new countries were added to the list today. Can be contained, but it requires fast interventions at all levels, and we have a challenge right now. One of the, and I'll close here, one of the sad advantages of the situation we are in is that this time is not that this pandemic is over, we can move on and forget. COVID-19 is still with us. A new variant may emerge at any time. We cannot lower the guard. We are seeing monkeypox emerging, and last week we had a new case of poliomyelitis in Mozambique, the second in Africa. Africa had eliminated Mozambique. Where is this coming from? From Afghanistan and Pakistan and the conflict area, which is another important, I think, priority for us, investing in those areas. But we cannot lower the guard. And so while we look at a pandemic treaty, while we look at longer-term political investments, the moment for action is now, and we really need to invest at all 3 levels right now without losing this opportunity that come on the back of a terrible tragedy for millions of people around the world.
Thank you very much for that very beautiful statement. And it's about investing, using the moment. And maybe even healthcare can be that bridge, that global bridge in an ever more divided world. I'm going to be much more pragmatic now and look at where healthcare is. And Frans, you said it before, healthcare is a fundamentally fragmented system. And Live alluded to the possibilities and the opportunities that digital is providing us. Now, working in healthcare, sometimes when I look at the provider landscape, for example, sometimes I have the feeling that we're asking the grocery in the main street to be developing a digital system that's needed for a big retail chain, which is not going to be possible. So when we look at the possibilities and actually the need of digital in order to keep healthcare accessible and the capacity of the sector to transform itself, can you reflect on the role of the private sector and what it means in terms of PPPs, public-private partnerships?
Absolutely. Well, let's first explore a bit what digital can do, because it's often such a buzzword, and therefore we need to unpack it a bit so that we have an idea what we mean. First, we need to talk about data and data accessibility. And that was already referred to. We need data to understand disease outbreak, population health, trend lines. If data is shared and available, we can analyze it using AI. We can be much more intelligent about the response that is required. And as part of health system sustainability and resilience, we need to create that data sharing environment in a much better way. Data will then help on the global level, but also on the local level. Digital can do actually a lot more. I think we have all learned how hybrid working and Zoom and Teams can actually change the way healthcare can be designed. Philips is participating in many telehealth programs where we see that supporting patients at home can actually reduce the rehospitalization rate by up to 50%. 50%! You know, all of that when hospitals are overloaded, overstressed, and workers have burnout. Right? Let's do that. Let's help people in their own community, in their own homes, through digital means. You know what? And the statistics and the feedback is that the people, actually their well-being goes up because they feel supported without the stress of having to go to hospital where they actually could become infected. Right? So many chronic lifestyle diseases can be helped remotely at a fraction of the cost with better outcomes. So for that, we need to redesign how healthcare is being delivered, which also requires some orchestration on the national level. It's appalling to see sometimes governments just lean back to say, well, this is a matter of providers and the public and the private sector. Yeah, but then nothing moves, okay? So we need to make sure that we team up together and get that done. I do see many countries starting. One of the interventions that national governments will have to do is to provide reimbursement for telehealth. And then it will take off. It will go very fast, as we saw during the pandemic. Another aspect of digitization is also how health workers among themselves can provide better orchestration of care. It is our estimation that there is some 30% waste in the healthcare system. And where other industries have leveraged digital to provide workflow optimization, information sharing, and reduce waste, healthcare has been relatively slow. In a way, it's still an artisan world, right, where everybody does their utmost, but the flow is not that efficient. And so we see digital also make healthcare professionals among themselves have much better handoffs, thereby reduce repeat exercises, repeat scans, and come to precision medicine for individuals much faster. Also there, I think we need that strong collaboration and trust, because transformation of healthcare takes some time. But I think I see a lot of preparedness and interest to get this done. At Philips, we strongly invest in healthcare informatics as a way to provide this both new delivery mechanisms, but also improve efficiency and effectiveness of healthcare.
So the 4 Ps of public, private, provider, and professional in a very strong orchestrated working together. I'm going to ask you all a last question, and because of time, please give me yours, your one key point takeaway. Surely for you, digital, what we sometimes fear is that digital, yes, it can improve healthcare, but it might create an even bigger divide because of the digital literacy and the digital accessibility. Your short view on that.
Thanks. I think 2 things, of course, really mark digital divide. Asia Pacific is very, very divided. The high-income countries societies are basically over 70% vaccinated, and the low-income countries are 16%. I mean, high-income countries are even boosted, and part of that has to do with technology and the ability to deliver and distribute vaccines and many other PPE equipment. So I think the divide in terms of government, civil society, and private sector investing in digital technology, creating trust to use and acquire that technology is very important. Second, it's very important for the region to actually cooperate with advanced countries in the world. The fact is, vaccines were developed basically by the West. And if we did not have that, to this day, I don't think Asia Pacific could be supplying the PPE, manufacturing, being the world's factory, if it weren't for the vaccines from the leading basically researchers in the world, in other parts of the world.
Emmanuel, can I take your view on that public-private partnership? And I know there's sometimes been some political debate, but do we need public-private partnerships to keep healthcare systems sustainable?
Absolutely. And allow me just to clarify, I do represent a WHO foundation,
yes, of course,
which is a foundation that has been created, is a Swiss foundation separate from the WHO to work with businesses, to work with philanthropies, to work with the public to strengthen WHO's mission. So if I'm here today, it's because I firmly believe in the need to bring the private and the public close together. And I find it's a pity that we have right now WHA happening in Geneva and WEF happening here, because we are somehow inadvertently maintaining a polarization between 2 different worlds that actually are part of the same ecosystem and need to collaborate. So from our side as a WHO Foundation, what we want is really to support the cooperation between public and private at the global level, but more importantly, at the country level. One of the main problems that we have seen over the years. I've spent many times in countries, living in countries in Africa and in other regions, is that when you come in with innovations, the opportunity to scale is there, but it's very often realized because there is no alignment with the governments. And when that is there, and it takes time, then the opportunity for scale is enormous. Is that what we at the WHO Foundation want to try to realize, bringing the business closer to governments and supporting that moving forward?
Yeah, so that means that it really needs two to tango in order to achieve that. Live, last question to you. I mean, you have been working, of course, in the development of the vaccine and the distribution of the vaccine. You've been working so much with governments all around the world. What are your key takeaways in order for healthcare systems to become sustainable? What do you as a private sector need from the public sector in order to be successful in that collaboration and in order to keep healthcare systems sustainable?
I think it's a little good to think about what really happened. If you take the two leading vaccines and the technologies around two leading vaccines, one of them in our case came from academic research, the other one came into Pfizer from a small company, German company. It's interesting to note that we have this debate on whether we should have national organizations, everything should be national and therefore be more autonomous, etc. I don't believe, frankly, in that at all. Just imagine if AstraZeneca had been a purely Swedish company and Pfizer had been a purely US company without the ability to roll out over 183 countries. That would not have been a much better situation. So I think be prepared to go to places cross-sectorally that you don't normally go to, and that should be both for government and it should be for private sector. Then I think the ability to execute on an international scale needs to be further supported by international agreements when it comes to supply chains. And we did have a stint of vaccine nationalism, as Professor Barroso was saying. We can debate that. It was clearly not good. We can debate why it came to the fore. But I think it's important to recognize that it cannot happen again. We cannot have a situation where what we are seeing as international resources are being used domestically only. That is not a good thing. And the way to do that, I think, is to prepare internationally now for the new situation, such that we can actually rely on good trading rules. And finally, I would say, let's not forget preparedness cross-sectorally and private-public partnership together on funding. We have a situation, for example, in the US, where both with BARDA and Operation Warp Speed, they were prepared to set up initially a fair amount of money. We have a very good discussion going on now in the European Union to create something very similar to that called HERA. I would support all of that. And the more we can do that on the large countries, the large continents, for example, Europe, China, I would love to bring into that picture, the more we can actually expect that to have also a global effect. So all of those are going cross-sectorally, go to places where you don't normally go, and be prepared with decisions already having been made on how to fund an eventual needed impact.
And that leads back to the remark on funding from the old Chinese traditions, funding on keeping populations healthy. Before I give the final word to Professor Barroso, I think what I would like to do on behalf of my colleagues on the PHSSR program, and we're very passionate about it, I can tell you that. We made a statement, and I'm just going to tell you the 5 key statements from what we want to achieve. We think that we need to treat healthcare as a strategic asset with an investment mindset. If we're not investing, we're not going to make it happen. We think we should all be working together to give a right to health, to give a right to care to everyone. We need to be prioritizing prevention and public health. We need to use and build that digital capability and a right governance framework around it so that we can make healthcare systems and public health systems more targeted, effective and responsive. And I think the plea here was as well, yes, we think that we need to work and collaborate across borders and sectors so that we can learn and act together. And that's what we want to invest in. everybody here who wants to help us to achieve that, please feel free to join us. I will end to, I mean, if I've got such an honorable guest as Professor Barroso, why not use him to share his last views and his key takeaways from this session with us? And sorry that we're with you.
In this matter of health, I'm more a student than a professor. And as a student, I took my notes. So my notes are the following. Following this very rich discussion, I really want to congratulate all the participants. First of all, if not now, when? After this wake-up call of this pandemic. So if I have to summarize, I would say 5 words: prioritization, investment, collaboration, transparency, and innovation. By prioritization, I mean a higher degree of political priority to this. By investment, I mean better and more investment in health, namely public health. By collaboration, I mean the need to overcome the fragmentation that was so rightly mentioned during this panel. By transparency, I mean the need of more data and metrics so that we have informed decisions. Finally, innovation, as was mentioned, from digital to artificial intelligence, there are today many, many instruments that can make us more effective. The final word is, and I think that could summarize the meeting, health sustainability and resilience is both a moral obligation and an economic priority. And we have to make the case, the economic case for this, because this is the important. That's why I think it's important also to take as a takeaway the idea of public-private partnership. And now that we are speaking so much today in the financial and the economic world about ESG, I've been already mentioning it several times, we should say ESGH, H for health. We should commit more resources also from the private sector to health, because we need that collaboration, not only the political collaboration of governments at national, the governments, but also regional and global level, but we also need the public-private collaboration. And that will be, to finalize, my last word is the sense of urgency that we felt today here. That, because there was the fear that after this pandemic goes away, and it's not yet over, that people relax. So we need to keep also, in terms of our priorities, the sustainability of political attention. It was a long summary, but the discussion also rich. Thank you very much.
Thank you. Thank you very much, Professor Barroso. And thank you to all my distinguished guests on stage here. And just a final one, practice what you preach. I'm definitely looking forward to the collaboration with you all in PHSSR, and let's do it together. Thank you very much.